Hello, this is Siddharth Tambar from Chicago Arthritis. An issue that I see almost every single day in practice, including today, are patients who have an existing arthritic joint and tell a story where they've received fairly routine arthroscopic surgery and have been told that they had a meniscus tear in the setting of their arthritis and that they need a clean out surgery. And they may have one or multiple of these over the years, and then eventually are told that they have bone-on-bone arthritis and need a replacement. There's enough data, especially when it comes to knee arthritis, to understand that routine arthroscopic surgery in the setting of an arthritic joint is completely and utterly the wrong thing to do. If you have, let's say, a significant catching sensation in the joint, you can make an argument that it may make sense to have an arthroscopic surgery in that case, but the vast majority of people that have arthritis in a joint and pain don't have a structural or mechanical primary problem. What they have is a degenerative problem, and that includes that they have likely had some kind of soft tissue injury sometime in the past that has left the joint or region unstable, leading to more pressure on the rest of that joint and area, which eventually leads to an arthritic process. In that kind of case, the problem is not a primary structural one, it's a degenerative one. And that includes instability, that includes neurologic and inflammatory issues. And if you take a strictly structural approach and quote unquote clean out the joint, you potentially can actually make things worse. For example, the data on knee arthritis and routine arthroscopy is that it's no better than just physical therapy alone. So in the case of a patient I saw today, she has a history of originally mild arthritis that has progressed over time, and she has had 2 knee arthroscopic surgeries over the last 3 years, and her symptoms have progressed, where she has progressively more pain, progressively reduced functional ability. In addition, she's now developed a chronic swollen joint in her knee as well. When you look at her imaging, in particular MRI imaging, what is most noticeable is that you see a progression of the osteoarthritic process in terms of narrowing of the joint, in terms of where she's had her meniscus surgeries. In addition, you also see that the bone overlying the joint has become progressively more swollen and inflamed, which then leads to more pain as well and more damage in the cartilage as well. There are a few really defining principles in regenerative medicine when it comes to osteoarthritis. As an example, stability is king. And when you have a soft tissue structure that's been damaged, instability is the name of the game in that case. And anything you can do to help promote stability, whether it's strengthening the rest of the muscles around that joint or using a biologic treatment like your own platelets or bone marrow derived stem cells to help strengthen some of those ligaments and tendons to help improve stability, that will give you a better functional improvement long term, as well as better pain long term, and just a better outcome overall. In addition, understanding that structure is not the name of the game when it comes to arthritis, tendonitis, and musculoskeletal orthopedic issues. Structural issues are part of the process, but it's not the only part, and it's certainly not the key when it comes to degenerative processes. More likely, it's more stability issues, neurologic, and inflammatory issues. Those are the keys behind regenerative medicine. We can still help out an individual that's had, as an example that I saw today, that's had those 2 arthroscopic surgeries and is worse off. But the reality is this person would have been so much better off if she had been treated in a regenerative medicine, nuanced and more modern manner. She'd likely get a better result in that regard. Those are the keys behind regenerative medicine. That's what's going to push this field forward. Thank you for your time. Leave me your thoughts, and I hope you have a good day. Live well.